Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we're back live on Facebook, and we have our very special guests who have been coming each week to really educate us on lots of things, mostly stem cells, the advantages of them compared to having operations for knees, hips, shoulders. And it's Dr. Robert Amoré, who is the founder of our integrative, well, the actual name is Amore Anti-Aging, and we're talking about regenerative medicine, and also the wonderful guy who's Rick Pepe. He's so jovial. I love when he comes in. Patient Educator, Amore Anti-Aging. So thanks for doing this every week, because I think over a period of time, people are going to say, why do I want to go to I don't want to get orthopedic surgeons crazy because they have a certain reason why you go there. But you actually have been filling in. We already have someone listening. Hello there. Why do you think that your process, I don't know if it's going to take over orthopedic surgery, but you're certainly going to get a lot of people who are going through that very traumatic operation and system that might be able to come and have stem cells done and PRP, and just why don't you tell us that, Dr. Amore?
Well, I think the big thing here is that people today are definitely looking for a change in the type of treatment that they've been getting in the past, whether it be surgeons doing knee surgeries or shoulder surgeries. That was the standard, and you're finding out that now there's something else on the block, so to speak. And now you can start doing stem cells, you can do PRP. So these procedures are less invasive, less downtime for like rehab, nil to infection. I mean, hardly any infections involved, which is a big one right there, because anytime you do a surgery, that's one of the big things they worry about is infection. So I think those are the three big points why people would want to change into something else. Now, the other problem, the other thing I see is that orthopedics, they do wonderful work. I mean, but the thing is, they've been doing it for a long time, and this is the standard of care. Now what we have to do is let people know that there's other ways of doing the same thing without that type of process, without that downtime, and trying to bring them into more of the future here where things are going. So I think that's really what we're looking at, and stem cells and platelet-rich plasma are two good things that could be utilized, and you can show proof on that.
Dr. Amore and Rick, I'll tell you something. I've been doing this for a long time, and I've always had orthopedic surgeons on, and for a long time, orthopedic surgeons, they actually were working with people who were in wheelchairs. And the reason it was so important was because it was a great thing that they could then do that. My husband, as a matter of fact, had 2 new hips. He had 4 different knees. But at the time, stem cell was not happening, or I would have definitely asked him to first do that. Now, his orthopedic surgeries were fine, but I know a lot of people's orthopedic surgeries weren't, and they had to go and have revisions, and it was terrible, and some of the big companies were sued, and you probably know the story, but you have a system now with stem cells and PRP that is, I would call it's not easy, but it certainly, I think, has more of a chance to give people less pain, less recuperation, right? So what do you think, Rick? Is that what do you tell people that?
Absolutely. I mean, the whole process here is, going through surgery is a lot of, rehab time, recuperation time. And the unfortunate thing is some people do not heal the way they're supposed to heal. Stem cells, on the other hand, you come in, you're there for about 45 minutes to an hour. Okay, we do the injections. You leave. When you have surgery, you're not leaving the hospital. You're actually walking out that day, out of when you're done with the procedure, you're actually leaving that day, going home, okay? And as time goes on, with the healing and repairing process, a lot of people, they first feel the pain start to diminish, right away, and which is a positive thing because most people want to get rid of pain. Pain is the biggest thing. So as the process goes on, a month later, they notice they have better mobility, flexibility. It's just, it's a good process. Surgery, you put a lot of trauma on the body, and that's not necessarily going to be a positive outcome.
Okay, well, let's do this. We know we have people listening, and I always want to make sure I give everybody a lot of information. So if you're on the web, go to amoreantiaging.com. That's AMOREANTIAGING.com. And if you just want to make a phone call to get a free consultation, you want to call them at 954-755-0224. And we have as our guests Dr. Robert Amore, and we have Rick Pepe. And so I want to follow through with what you were saying, Dr. Amore. Someone comes in and you have to evaluate them. You have to know if it really is what they need, because maybe it's not, right?
Right, that's true.
All right, and then do you set up an appointment, and is there any prep work, or what do you have to do to just have them come in? Is it in your center that this is happening? Do they sit on a table? What goes on?
It's in our center, and it's like, we'll have them come in, we'll do an examination. If we'll take some x-rays, and we'll review the x-rays and the examination. We'll get information on that individual, everything we want to know about this individual, what they've done over the last so many years, what injuries they've had, what traumas they've had, what surgeries they've had, what medications they're allergic to. We go through a whole complete checkup. And this is how we formulate what we're going to do next. And depends on conditions of whatever they're coming in for, whether it be a knee joint or something. If the knee joint, looks arthritic or there's changes there, it depends the degree of change. But we can say to them, listen, this might be something we can try, or would you like to go more conservative? We could do this way. There's different things you can do. You don't have to jump to surgery yet. Surgery, I always like to say, is the last thing. The last thing I ever want to do is surgery. If you don't have to do it, don't do it. Because your body doesn't handle surgery so well sometimes.
Okay, so let's say they come in and they have pain.
Yeah.
And you've diagnosed them. Is there a shot you can give them that day?
Yeah, you could. Yeah, not so much a stem cell shot, but we could do other shots, other things we could do. It's not always a shot that they need. You can have pain, and why do you have pain? I mean, what reasons why do you have pain? That's what you have to address. So a lot of people have pain because they don't exercise, they don't take care of themselves, they overweight. And not just necessarily having joint pain, it could be pain from other things that they're not doing. So I always tell them, I say, listen, let's check everything out. We want to get you to the best you can be again, okay? Let's find out what's going on. And that's what we do. And then, I'll break it down with them. I'll find out what they've done. And then once I diagnose and tell them what's wrong with them, because a lot of times it's not a joint issue. It could be a physical issue. In other words, they don't exercise anymore. I'm older now. I don't need to exercise. I did that when I was 15. Now I'm, 70.
And that could cause pain.
Sure. If you don't exercise, the biggest thing that causes problems to the body is when you don't move. If you don't move and do exercise or walk or do something that's physical, you break down.
Okay, so now let's say that you decide that stem cell is perfect for them. What kind of a preparation do you have to do?
All right, for that, then what we'll do is we'll go ahead and do prep regarding blood work. So we'll do some blood work first and rule out some things, and then we'll check on the medications they're taking. And we'll let them know that if we do these stem cells, you're going to need to be off an anti-inflammatory for a week and 2 weeks after. We don't want them taking any type of anti-inflammatories because that really disrupts the stem cell, making its place where it belongs. So you're trying to get the stem cell to grow in an area. So if you take an anti-inflammatory, we're not producing inflammation. We need inflammation for the stem cell to head toward. You want to have inflammation. Your body works on healing through inflammation. So when you take it away, it slows down your healing process. So, all the orthopedics that I know give some type of medication for anti-inflammation. They don't want to have inflammation, and that slows the process down. They don't always tell their patients that, but that's what they do. So, the whole process is kind of like not the best way to go, but that's what they do. So you want to not do that. You want to create inflammation.
So Dr. Amore, I think that's where Rick then really joins in and does such a great job, because that's why when you first introduced me to him, and he's called the patient educator, he's going to have to spend time reversing this inflammation idea, right? And so Rick, you're going to re-educate them, because they're going to say, oh, I was told that I don't want inflammation. You're telling me I want inflammation.
That's part of the process of the healing, repairing process of the body. Just like when you exercise, when you work out, you break down muscle. When you break down muscle, it causes inflammation in that muscle cell. That muscle cell grows bigger and stronger for the next time that you train. So it's the same thing with your joints. People, don't get it. The first thing they want to do is take either Advil, Motrin to try to kill the pain, which, listen, we all don't want to be in pain. So anything to get rid of pain. But unfortunately, when you do that, you're destroying, the structure of the tissue continuously. So until you get, like we were talking in, the first show, there's a timeline for all diseases. Usually people towards the end of the disease timeline is usually the worst place you want to be. By that time, you need to either have knee replacement, hip replacement, shoulder replacement. You need some type of surgery. And this is where the stem cells come in to help to heal and repair that area. Okay, I just read a study just yesterday on cortisone. So people taking cortisone with the stem cell. Believe it or not, that stem cell did not migrate to where it's supposed to be for 6 months. They did away with the cortisone, and then it started to start to grow in that area. So it shows, that study right there showed that an anti-inflammatory slowed or even cut off the stem cell from doing what we're supposed to do inside the body.
I guess it's because this whole stem cell regenerative medicine is fairly new. I mean, maybe
Correct.
it's 5 years, 10 years, but it's new. And so you all have been doing it for a while, so you know a lot of these things, but you have to convince them. Now, a lot of times they they have their own primary care doctor. Mm-hmm. And how does that work with you, Dr. Amore? If they have a doctor, do you work with that doctor, and what goes on?
Yeah, if I have some connections with other doctors and they have a case that they want to refer out, they refer to my office, a case that they can't handle. So they say, look, why don't you try this? The thing is, again, like you said, regenerative medicine is rather new, though it's been around since 1913, but it's rather new here. So I think it's hard for a lot of people. If you deal in the healthcare business long enough and you deal with auto accident victims and all these things, and you're talking to lawyers, they're not looking for stem cells. They're looking for you to do surgery, because that's where they make their money. They're not going to make their money off stem cells. So if someone's in an auto accident, right, and they have an injury, they are looking for that patient to go get surgery, because that, in their viewpoint, they're going to raise the money up more to get paid. So, a lot of that comes into play when you're dealing with auto accidents. So people are not, lawyers and doctors aren't always looking, because they don't make money. So they're not looking to do that. Stem cell, I'm trying to give stem cells to people that are looking to get better, not looking to go down the same path that they've been going and heard about for years, because that path doesn't take you anywhere. You end up, once you have surgery, you're probably going to have some problems later on in life. It's not going to get 100%. Once you cut the body, you're not 100%. So let's try something a little bit more advanced and better for you. So that's why we're going stem cell.
Well, let's go to what you just said, auto accidents. I had never put that into my brain.
Yeah.
So auto accidents, people who now are listening.
Yes.
Some more people. So now, auto accident, you have a pain, right? Because you were, someone crashed into you in your brain or something.
Right. So say you get hit from behind, which in Florida happens just about every day.
And as a chiropractor,
yes,
these
is
were
one
the
of the
kind
things
of people,
you see. And they would come into the office and they would be treated. But if there's an attorney involved and you refer these patients to orthopedics and they do their whole, evaluation, but the whole thing between the auto accidents and the attorneys and the doctors they're trying to build a case. So in order to build a case, you have to show that that person's hurt, and that's why that person's coming in once a week, twice a week, whatever the reason is. You don't want someone to come in for the sake of coming in. So you want to try to get them better, but they need to have some type of injury. So the thing with when you have something like this, they're looking down the line as, okay, well, we're going to refer you out for surgery or a surgical consultation, because as lawyers would look this way, because this is going to help your case and possibly getting more money from the insurance company. That's what they do, and that's how they deal with that. So
are they all right? But let's just say that there are many physicians out there who really want to use stem cells. They have a good, they're good. They appreciate their practice. Will you explain all this to them? I mean, a lot of the doctors, I don't think, really get this yet, right?
No, they don't.
So do they come into your office? Do you have, seminars? If you had a few doctors, would you put on some sort of a seminar?
No, we're already setting up a seminar now. But, I will educate as many people I can regarding stem cells and how it really works. I mean, the reality of auto accidents, workers' comp accidents, I can go on, and all these different types of insurances that they have out there. Stem cells are not covered under insurance, which number one. So that's another reason why they wouldn't even refer for that, because it's not covered.
I have to tell you something now that you talk about insurance. As you know, I've had a wonderful dog, and I spent a lot of time at the vets. And I saw people paying $800, $900, $1,200. They take their credit card and they hand it to them. If those same people came into your office, they might say, "What? No insurance?" I mean, I really saw how people with animals will pay the money, but for themselves they may not. But that's okay. There are plenty of people now who understand that a lot of new procedures do not take insurance. But tell us, I'm backtracking a little bit. What is a stem? Why is it called stem cell? What is a stem?
You want me to answer?
Yeah, no. Okay, you do it.
Right,
or
so,
if you can do it, I don't care.
All right, so a stem cell is a neutral cell. It's the best way. The easiest way to explain it. It's neutral. It's like Switzerland. So it's neutral. It doesn't have any DNA in it. It's a cell that can proliferate or differentiate. All right, so it's a cell that you can inject into your body, and it can either form more of those same stem cells, or it can differentiate into a muscle cell, a bone cell,
Amazing.
A heart cell,
It's like
whatever
miraculous,
tissue,
isn't it?
right? So that's what those are.
Okay.
They just, stem cell. But so they're cells that are produced when you're very young. Okay, and that's why we get them from a full-term pregnancy from the cord, Wharton's jelly of the cord, and the placenta of the cord. So that's where we get that, and we go ahead and we utilize those cells after they're cleaned up and everything and reviewed. We utilize those to create stem cells or more other types of tissue cells, and that's what they do. And when they go into your body, they kind of couple with your DNA, become your DNA. There's no DNA on them, so they become. That's why there's no rejection problem. So they become you.
How does it know where to go?
And this is where we get back to the inflammation process, right? So when there's inflammation, that's where they head toward. They head toward inflammation. So if you have, say, a really bad knee injury, and it's inflamed all the time, they're going to head there. But if you took your stem cells from your bone marrow and then you inject it into the knee with your other stem cells, or with your stem cells, it's going to go back to where you pulled them from, because that's a pretty new injury, a new inflammation process. It's going to go right there. So that's why I don't like to pull from bone marrow or from fat tissue or anything like that in your own body. I'd rather get brand new stem cells. And from your own body, you don't have as many stem cells. So you won't, if I can get millions or billions of stem cells out of a newborn, and I can only get a couple hundred to 1,000 out of it, it's not worth it. I mean, the odds are not in my favor. So it's best to get clean, new stem cells from a full-term pregnancy.
Okay, Rick. So I'm going to ask you a question, but let me give some more information out. Just be thinking about my question, please. The question is, we talk about stem cells. So are there millions of stem cells that go in, and just is it one little guy that's the one little stem cell? So I'm going to let you answer that in a minute. I'm talking with these two fantastic, I guess one is a physician, the other one is a patient educator. It's Robert Amore, who is the owner and founder, and Rick Pepe, who is the patient educator of Amore Anti-Aging. And the way you're going to find out a lot of information, they have a very, very nice website, is Amore, A-M-O-R-E, antiaging.com. And if you would like to call them, you can call them at 954-755-0294. They're located in Coral Springs. They're voted the best regenerative medicine clinic. Says a lot. They're on North University Drive, easy to get to, and they do a lot of things. So what's the answer to that? Are all these stem cells going to be running all over my body?
No.
Okay. No.
They'll be injected, like, again, we're talking about the knee. They'll be injected into the knee. You're talking about billions of stem cells, which will help whatever issue that you're having in that particular area, just like the doctor was talking about, proliferation, to help to create new tissue, either tendons, ligaments, cartilage, the hyaluronic fluid, to help support the chondrocytes, which is basically bone against bone. So it'll help to even regenerate that area. So, and again, there is, the technology that we have today, a lot of people are starting to get on board and start to do these type of procedures. And a lot of customers that we have already, patients, they can't believe there's no downtime, and they don't have the pain that they would have if they did surgeries. Surgery should be the absolute last resort, because once you have surgery, once you have a knee replacement, hip replacement, shoulder replacement, whatever replacement, there's nothing we can do for you. Okay. Because it's an appliance. There's nothing we can do.
Okay, and will it last? Will the stem cell last? It
will last, it'll last a lot longer than a knee replacement or a hip replacement or a shoulder replacement. It can last anywhere between 15 to 20 years.
And so when that's done, is there like a bulge in that area where you've done
None,
this?
Zero.
You don't know?
You have no idea.
Sounds pretty exciting. So, Dr. Amore, this is...
It's like a mosquito bite. That's all it is.
Like a mosquito bite. Dr. Amore, it's this must make you very happy because you've been a chiropractor in the medical field for a long time. And when did you first discover that that's what you wanted to do?
Stem cells or chiropractic?
Yeah. Both.
Well, I always liked healthcare. I always liked health. I always liked getting your body to the best it possibly can be, naturally. So I believe more of the natural techniques. I feel, I've been doing this for a long time, like over 32 years, but I think that with the stem cells, that's something that's up and coming. It's been up and coming for a while. It's just starting to push through, and if I can get people to understand that there is hope, for them to get their abilities or their mobility back, so to speak, and able to do the things they were doing prior to their injuries without going through a surgical intervention, then I think, more people will start coming and they'll see the light a little bit more. The biggest thing you hear from people, my insurance doesn't take this. I said, insurance does not, pay for that because...
That's the vet story.
Yeah.
Okay.
It's the same, it's the same.
Vet story. Just,
it's about,
how much have you spent on your dog over the last couple of years?
And people, you have to look back and say, how much do I want to spend on me? How much do I want to do for me? Do I want to live a good life, or I want to, complain about all my little issues?
So some of the people that you've done stem cells, what's the oldest age? Is there an age limitation?
There's no age limitation. I'm trying to think the oldest. How old was
have you done someone in their 80s?
I think we did do someone 80. Yeah.
And so age is not a factor in the stem cell, is it?
Not really, no.
And it's better for the patient, especially if they are older. When you have surgery when you're 80 years old, the complications.
The rehab is harder.
Absolutely.
But the stem cell doesn't know age, does it, when it goes
No, it does not.
No. And think about what you're doing is you're putting in, the best, I'm going to say I can explain this to you. If you're older and you're putting something young into your body, that's not the best thing.
Yippee, right?
Now you're getting a boost, right? And you start to feel better. Not just your joints, but your mind. And that's another thing people forget. Their mind starts to become sharper. Everything gets better. So this is what you have to look at, and this is what people need to realize. If you go to the standard, care that you've been going all your life, I mean, you're still going. I mean, do you want to keep on going to the doctors, or you want to get better and go live your life?
Okay, so now I have so many more questions. We'll have to wait for next week. But one big question is, why don't you just put stem cells all over my body so I can be now 20 again?
Well, we could do something like that.
So we'll talk about
we'll talk about next time. We do have
just
something like
shoot
that.
me up.
We have that.
Oh, wow.
We do have
okay,
something
we
like
missed
that.
Okay, well, thank you, everybody, and for listening. And if you'd like more information, go to their website, amoreantiaging.com. And, of course, will be on YouTube in a few weeks. Thanks a lot.
Thank you.
We appreciate you.